Person-centered care is a theoretical framework developed by McCormack and McCants. It's made up of 4 processes. Each one of these processes must be followed in order to provide person-centered care. Person-centered care is defined as collaborating with the patient about their treatment, including them in the decision-making process, and getting their input on the cares they'd like for the patient to get back to their original health. An individual treatment plan tailored toward that patient, for example, not using the same cares or treatment plan for everyone else, is important. The first phase is a prerequisite phase. Its main focus is on the nurse. The nurse must be professionally competent, have developed interpersonal skills, be committed to the job, be able to demonstrate clarity of beliefs and values, and knowing oneself. Phase 2 is the environment in which the care is given. The environment must facilitate shared decision-making, effective staff relationships, support organisation systems, the sharing of power, and the potential for innovation and risk-taking. Phase 3 is person-centered processes, which focuses on the patient. Understanding about and working with the patient's values, beliefs, and culture is crucial. Engaging with the patient, sharing decisions with the patient, providing for their physical needs, and having a comforting presence are all factors that influence the patient's experience. The fourth and final process is the expected outcome. The outcome should be that that patient feels satisfaction with care, involvement with care, feeling of well-being, and creating a therapeutic culture. Key contributors to patient-centered care processes are: first is working with the patient's beliefs and values. Acknowledging, understanding, and working with the patient's values and beliefs during their care. Incorporating the patient's beliefs and their values leads to a tailor-made treatment for the patient. Patient education increases patient compliance and patient satisfaction. Next is providing holistic care. Providing care for a patient involves more than just their physical health care needs. Holistic care underpins the whole patient. This term refers to the patient's emotional, physical, social, spiritual, and economical needs. Nurses create a rapport with patients which develops the nurse-patient relationship, which allows for better holistic care, meeting all the patient's needs. Providing the patient with respect, engaging with them as an individual, and using open communication are aspects of holistic care. Next is engagement. Engagement refers to the patient and their family being active participants in working with clinicians and healthcare professionals. Patient engagement improves the health outcome for patients in hospital and in the community. Research proven patient families engagement allows for a higher collaborative care plan, more so than direct decisions of care. Next is having sympathetic presence. Sympathetic presence is showing compassion, empathy, kindness, and support to a patient. Understanding how a patient may be feeling as being in hospital can be a daunting challenge to face. Sympathetic presence builds on empathy. Showing empathy is having the ability to share and understand the feelings of the patient. Lastly is shared decision making. Shared decision making is the collaboration of the patient and the clinician to establish the best treatment plan that suits that patient. Treatment plans should be based around the patient's beliefs, values, and their goals. Research has shown that there is a higher satisfaction rate from patients being involved in their care, as opposed to patients that have not. The Leadership Challenge model aims for evaluating one's ability to lead a group and what characteristics of a good leader poses. The 5 categories that defines exemplary leadership include Model the way, inspiring a shared vision, challenge the process, enabling others to act, and encourage the heart. Firstly, model the way is visualizing a principle or concept from a situation that would cultivate change, that would yield positive results as you lead that change and by showing it to others. A good example would be promoting cultural safety in the workplace. Might encourage the Indigenous people to prolong their stay in the hospital and finish the treatment. Setting the standard of behaviour, respecting the patient's wishes, values, and needs. Inspiring a shared vision is having a common vision or shared values with other colleagues in which outcomes can be predicted already as a successful result, aspiring them to reach that goal. Having a shared treatment goal set between clinicians and the patient empowers the patient to make active decisions regarding their medical treatment. A challenge may arise if there is a difference between nurse and patient values, for example, religion. This could cause a potential barrier and cause conflict. Challenge the process encompasses placing of ideas and principles taken to the test, and any mistakes or obstacles were taken as a learning curve to improve. A challenge may be when trialing a new technique in giving a medication despite the limited experience. Staff nurses are aware of any errors and missteps and will be noted. Nurses not staying up to date with practice changes, not willing to learn, grow, or innovate their practice. Enable others to act is referred as inspiring people to take the challenge by building self-confidence, supported by collaboration and trust. Cooperative goals, building trust, offering support, and encouraging people to share information. These are fundamentals of person-centered care. Everybody becomes involved with the decision making. If nurses provide nursing practice that the client deems to be unsafe or not appropriate, that leads to mistrust, fear, and disengagement. For example, many of the Aboriginal and Torres Strait Islander clients have a fear and mistrust of nursing health due to historical racism. And lastly, encourage the heart is about recognizing the hardships and struggles and promoting and practicing the principle. Praises and recognitions for patients or nurses' efforts incorporates a positive emotion, a sense of community, and inspires them to carry on. Challenge is when the nurse did not recognize the input or wishes of the patient or not celebrating the patient's accomplishments. An example of a practice innovation is telehealth. Telehealth is a telecommunication application used on devices such as mobile phones, tablet, or computer that provides access to healthcare services to patients who live in remote or rural areas. The service is used to provide clients with telemedicine, health education, and medication education. The telehealth application uses a video conferencing style platform where the users can video call to conduct a face-to-face consultation. Telemedicine is used by physicians where telehealth is used by nurses, pharmacists, and other allied health professionals. In Australia, there are 3 different forms of telehealth service available, which include real-time service. This is the most widely used type and includes video conferencing. Next is store and forward, which is the sharing of stored digital information, such as a patient's scans, case notes, test results that are transferred securely to another relevant specialist. And lastly, remote monitoring, which is known as telehealth. Telenursing services allows nurses to provide care to patients in their homes via telephone, video conferencing, or via computer. Many health organizations have implemented telenursing in call centers. Health organizations have started call centers where registered nurses act as case managers and perform patient triage, information, and consultation to the people to divert them from waiting in emergency rooms unnecessarily and to reduce workloads. This service has many benefits. These benefits include increased patient engagement in healthcare services, easier access to healthcare services, real-time consultation, better patient outcomes. It increases clinicians' flexibility, availability by reducing their travel times and associated costs. The service reduces the travel time and associated costs to the patients and their families, reduces the needs for patients to be away for periods of time from their homes, work, and families, reduces appointment waiting times, more cost effective. It's estimated to save the Australian health service 2 to 4 billion if it's adopted across Australia, and online appointment booking features. Thank you.